Right, so we finished with the topic thermoregulation and also heat-related injuries. So as continuation of the lecture, we will now discuss on the hypothermia and cold-related injuries. Hypothermia is unintentionally fall of body core temperature below or equal to 35 degrees Celsius. So in the wilderness, this is related to the exposure to an environment. Therefore, therapeutic hypothermia that was done in the hospital is not considered as part of the hypothermia that we are going to discuss today. The hypothermia can occur at any seasons, although it is most commonly occur during the winter. Another thing that we need to understand that it also may occur in the tropical countries, including our country, Malaysia. Last time, people used to say that it is impossible to develop hypothermia in our country because we have such a very hot weather. This is particularly not true because there are many places in Malaysia that have cold temperature, especially at the deep jungle at night time or at a high elevation like Mount Kinabalu. So in 2025, we have this very unfortunate event in which that one of the hikers was actually injured and was left alone at the peak of Gunung Liang. The search and rescue team found him motionless and was confirmed to be dead. And the cause of death was hypothermia. So this case highlights the importance of understanding what is the hypothermia and how to manage the hypothermia in the wilderness setting. We discussed in the previous lecture regarding the heat loss mechanism, and we know that evaporation and radiation are two types of mechanism that most of the heat we lost from our body. Apart from that, it is also due to conduction and convection. There are a few methods that can be done to prevent the hypothermia. First of all, we should avoid outdoor activities during cold weather, especially during the extreme cold temperature whenever possible. But if the outdoor activities are necessary, one should wear appropriate insulated clothing to minimize heat loss. Always bring snack and food so that you are able to eat it at the regular interval to maintain the energy reserves, especially if shivering occurs. Avoid alcohol or recreational drug when participating in activities during the cold weather and maintain the adequate hydration. If you need to travel during the cold season, please do it in groups whenever possible. And always carry extra clothing and spare insulating layers when undertaking outdoor activities. You can actually wear this 3-layer dressing during the cold weather. So it contains the base layer, insulated layer, as well as the outer layer. So the purpose of base layer that is worn next to the skin or at the innermost part is to wicks moisture away from skin and keeping us dry. So it should be made from the material that is moisture-wicking synthetic fabric or merino wool. Examples of the clothes are the thermal tops, long underwear, as well as base layer leggings. The insulating layer or the middle layer is aimed to trap body heats by holding the warm air close to the body. It is usually made of fleece, wool, or synthetic insulation. It should be well loose enough to allow space for insulating air. For example, is the use of fleece jacket, wool sweater, or insulated jacket. And finally, for the outer layer, it is used to protect against wind, rain, snow, and reduce heat loss. It is made by the waterproof, windproof, and breathable fabric. For example, is the hard shell jacket, ski jacket, rain jacket, as well as shell pants. Hypothermia can be classified into the mild, moderate, severe, and extremes. It is best to measure the rectal temperature, but most of the time it is often difficult to be performed at the field. Therefore, best way to know the level of hypothermia that the patient has is by observing the symptoms. In mild patient hypothermia, patient will have the shiverings and difficulty in performing complex tasks, having apathy, confused, impaired speech, and easily falls. So this can be remembered by using the mnemonic umbles, which is the stumbles, mumbles, fumbles, and grumbles. In moderate hypothermia, where the temperature is about 28 to 32 degrees Celsius, patient will have the uncontrollable shivering and worsening of the umbral symptoms. In severe hypothermia, is when the temperature is less than 28, patient will enter a phase in which the shivering will stop and the muscle will become stiff, unconscious, having bradycardia or other type of arrhythmia, and reduced respiration. Extreme hypothermia is being classified as less than 24 degrees Celsius, and in some reference it put as the less than 20. So at these temperatures, the risk of death are much more higher. The lowest core body temperature that is associated with survival, being recorded in the case report, was 13.7 degrees Celsius. If you look at the guideline published by the Wilderness Medical Society, they will divide this hypothermia management based on this whether the patients have shivering. Next is by having at the conscious level and go to the sign and symptom of life through the ECG monitoring. But this is actually quite detailed for wilderness first responder or the basic remote medical responder to know about everything. But if you are interested to learn more about this, and especially for the healthcare professional that work in the remote environments, you can have a look at our course materials or review the guidelines that was published by the Wilderness Medical Society. As a general management principle for the hypothermia, first is that to assess and prioritize, check the responsiveness, breathing and pulse, and treat life-threatening first, and handle the patient gently. It is actually best to move out the patient out of the wind, rain, and also the snow, and protect the patient from the cold. This includes by building the shelter, insulate from the ground, remove wet clothing, add dry layers, and cover the head, neck, and the whole body. Then you should start gentle rewarming by using available insulations like blanket clothing or sleeping bag. You need to rewarm the core first. If you need to move the patient, handle gently because the movement can trigger dangerous heart rhythms. Next is by giving warm, sweet fluids if patient is alert. Make sure that it is a non-caffeinated drinks. But if the patient is not alert or not able to swallow, do not give anything by mouth. Monitor the patients regularly, especially changes in breathing, responsiveness, and also pulse. Prepare the patient for the evacuation as hypothermia is a medical emergency and you want to evacuate the patient as soon as practical. During the evacuation process, continue rewarming and monitoring so that patient did not develop worsening of hypothermia. All patients with hypothermia need to be handled with care because rough handling or rapid rewarming can cause the cardiac arrest. Be calm, deliberate, and gentle. And finally, if the patient is already being warmed, and aftercare still need to be provided, you should keep patient insulated and dry and watch for warming signs like shivering or improved alertness, and finally arrange for further medical evaluations. You can actually buy this hypothermia prevention management kits. It was actually been developed by the US military, but now available for the public as well. So it consists of heat reflective shell with ready heat blanket and 4 chemical heat pack. This can provide a continuous heat for about 6 hours. But if you do not have it, of course, you need to do everything that you have. So last time we have these cases in Mount Kinabalu in which the patient developed severe high altitude mountain sickness together with asthma exacerbation, and patient was actually shivering, that indicates that possible that he had this hypothermia. So we can use actually this improvised insulation method by wrapping the casualty using the heat insulating layer or plastic survival wraps. You can also use the garbage bag if there is none of the things available. Make sure that the casualty is completely protected from the direct contact with cold ground, snow, ice, wind, or other cold surfaces to minimize the further heat loss. There are some special conditions that can be used in the hypothermia patient, but this is reserved for trained advanced healthcare providers. For example, if you need to intubate or use the supraglottic device for the patient, and you need to give medication, use a lower dosage and extended interval of anesthetic or paralytic drug if the temperatures are below 30 degrees Celsius. Once you are able to put the advanced airway, so you should ventilate at half standard normothermic rate. Without advanced airway, patients should be ventilated at standard rate or use the ETCO2 to guide ventilations. If patients are found at high elevation, especially above 2,500 meters, you should use the supplementary oxygen. If the advanced airway was put, then you should insert the nasal or gastric tube as well. Perform the CPR if patients show no sign of life. This can be monitored using the cardiac monitor, ETCO2, and also ultrasound. The chest compression should be provided at the standard normothermic rate. However, if the patient core temperature is less than 30 and patient develop VT or VF, or the AED advises a shock, you should give one shock at maximum power. Then, you should warm the patient at 1 to 2 degrees Celsius or more than 30 degrees before giving the additional shock. You should not give any vasoactive drugs until the temperatures are 30 degrees or above. So from 30 to 35 degrees Celsius, increase the dosing interval to twice as long as normal. CPR may be delayed or given intermittently if necessary to accomplish evacuation. There were no temperature cut off for the CPR, unless that there are contraindications, for example, like the body is already rigid and shows signs of being frozen, or there is also the presence of severe trauma. So, consider transcutaneous pacing if patient having bradycardia with hypertension. You should terminate the CPR if potassium are more than 12. When we are evacuating the patient, we should actually take the patient in horizontal position, and the equation should be as low as possible because we want to prevent the afterdrop or circumrescue collapse. In afterdrops, the temperature continues to fall in core temperatures. This will occur during the early rewarming periods due to the redistribution of cold blood from periphery to core. This will worsen the hypothermia. In central rescue collapse, there is a sudden cardiovascular collapse or cardiac arrest that can occur before, during, or shortly after the rescue. This is usually due to cardiovascular instability that was triggered by rescue or extraction, causing cardiac arrest. Hence, to prevent both things, it is important to continue giving insulation to the patient, active core rewarming, gentle handling, horizontal rescue, and minimize exertion. If you need to evacuate the patient using the ambulance, make sure that you pre-warm your ambulance first and make it at least at 24 degrees Celsius. And of course, you should also watch out for the rewarming technique. For example, like not to bring the heat pad in the helicopter. If you are using the heat pad, you need to make sure that the ambulance has a carbon monoxide detector or monitoring devices. Right, we go to the frostbite. Frostbite does not occur in Malaysia unless you stay in the ice box. Why? Because you need a constant exposure to ambient temperature and below -5 degrees Celsius. The skin and tissue become frozen following prolonged environmental exposure to extreme low temperature due to vasoconstriction and tissue ischemia. This can be precipitated by cold stress, low temperature, moist air, inappropriate clothing during outdoor activities like having a tight clothing, in contact with very cold metal or gasoline, and disturbance in blood circulation like tight clothes or boots, dehydrations, any vascular diseases, and position that predispose to cramp. I will not discuss in full detail about the frostbite because that is not happening in Malaysia. But generally, you have 4 phases of frostbite, which is the pre-freeze, freeze-thaw, vascular stasis, and late ischemia. Frostbite referred to the superficial frostbite, and frostbite also has 3 severity based on the level of tissue involved. Apart from the frostbite or the superficial, you can have the partial thickness and also full thickness. So the full thickness frostbite is when there is a gangrene part of your limbs. To prevent the frostbite, you should maintain the peripheral perfusion, mild exercise, and protect your body from the cold. As principles of management, patients should be protected from further exposure, handle gently, rewarm, warm monitor, and evacuate if necessary. There are certain medication that can be used to treat frostbite, especially those intended to vasodilate the blood vessels. This is more commonly occur in our setting, which is non-freezing cold injury or being called trench foot. It happens because of the foot are being exposed to a prolonged damp and cold weather. It requires minimum contact of 3 and 12 hours to develop the serious injuries. Apart from the trench foot, the immersion foot can also occur when the legs are constantly submerged under the cold water. To treat the non-freezing cold injuries, of course, you need to prevent this thing to happen. How? Is by regularly keep your foot dry. If there is any cut or abrasions, you should treat it early to prevent infections, as it may predispose to worsening of non-freezing cold injuries. And of course, you should also provide pain management, especially by using the paracetamol and NSAIDs. If there is evidence of impact perfusion, then patients should be evacuated as soon as possible. So with that, thank you for listening.